information to give after.
I think that, well, in Minnesota, as a physician, I received an email last week from the Department of Health coaching me on how to fill out death certificates. And I've never really received coaching from the Vital Statistics Agency in terms of how to do a death certificate. But basically, I felt like they were saying, you know, you don't have to have a confirmed laboratory test for COVID-19 in order to make the death certificate be COVID-19. So
wait. Sir, I don't mean to interrupt you, but that what you just said, I think is critically important. Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia after and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I'd printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning. And it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people, and I worry about that. I worry that sometimes we're so darn interested in just jazzing up the fear factor that, sometimes people's ability to think for themselves is paralyzed if they're frightened enough. And that's not where I want people to be. I want people to say, we're going to get through this. I'm going to use my head. I'm going to go to different sources. I'm going to listen to different sources. And I'm going to think for myself, because that's what America's about.
Senator, if you don't mind, after this interview, if you can send me that 7-page document. And just for clarity, you were sent a 7-page document by who again?
The Department of Health.
Department of Health saying, hey, fill this out, whether they test positive for COVID. That is stunning, sir.
Now, you saw how caught off guard the anchor was, right? I mean, he was completely caught off guard. The next day, because this story blew up and people were sharing it all over the place, the next day, this small affiliate station went out of their way to bring people on to debunk the senator, including the anchor who said, was pretty much leaning towards, it was misinformation. It wasn't true. He was exaggerating, blah, blah, blah. And this is how it works. This is how they create fear. This is how they spread it, right? By saying that these numbers are what they are. Because people go, well, even if it's not real, how do they make this stuff up? How do they say so-and-so passed, and then you can confirm through the death certificate that so-and-so passed? Because they're being told to put this on the certificate. If somebody's even, listen, you heard what he said, right? Somebody was diagnosed with influenza, but they came in contact with somebody who may or may not have had symptoms of it 6 weeks prior to put it on there. And that's completely irresponsible. But that's how deep they have this whole thing figured out. This whole thing is a collaboration. They've been planning this for a long time. We've all seen Event 201, the footage from there. We've heard Gates talking about it for decades now. Every little thing, every little intricacy, they've already figured out how to do and what to say. This is something that comes out and then they just completely deflect off of it. Completely. So Dr. Scott Jensen, who's a Minnesota family physician, also a Republican state senator, he said that the CDC guidelines for doctors to certify whether a patient has passed of the virus that we're speaking about are completely ridiculous and misleading to the public. He said, in cases where a definite diagnosis of the virus cannot be made but is suspected or likely, it is acceptable to report it as this virus we're speaking of on a death certificate as probable or presumed. So it's like we've all been saying, they don't even have the tests, right? What do you think these stories like, oh, we don't have enough testing, not enough people are getting tested. Then what a coincidence that they don't have all these tests, but so many people are perishing and they aren't even taking the test. They're just dying of heart attacks and respiratory failure. And somehow they're just diagnosing it as this because that's what they're told to do. And they're following orders. And then the media comes out, and what does the media say? The media says the numbers are way larger than we're being told. So all the numbers that we're hearing right now, which sound ridiculously high, they're saying that New York City has more than any country now. They're saying it's way worse than that. It's way worse than that because they're saying, well, because some people are dying from it, but they haven't even been tested from it. But then you're coming out and you're telling us people are dying from all these other things like influenza and pneumonia, and you're putting it on their death certificate as if they have it. And then you hear family members come forward, if you look deep into this stuff, and they go, my grandfather passed from pneumonia, not that. And so why is it on a death certificate? And the CDC comes out and says, well, because he may or may not have been in contact with somebody who had it, and we want to be responsible here and make sure we get the numbers correct. This should make people pissed off and suspicious. Quote, the idea that we're going to allow people to massage and sort of game the numbers is a real issue because we're going to undermine the public trust. And right now, as we see politicians doing things that aren't necessarily motivated on fact and science, their trust in politicians is already wearing thin. Jensen gave a hypothetical example of a patient who died while suffering from influenza. If the patient was elderly and had symptoms like fever and cough a few days before passing away, the doctor explains he would have listed respiratory arrest as the primary cause of death. And he said, I've never been encouraged I would probably write respiratory arrest to be the top line, and the underlying cause of the disease would be pneumonia. I might well put emphysema or congestive heart failure, but I would never put influenza down as the underlying cause of death. And yet that's what they're being asked to do here in regards to this virus that we're currently seeing. Think about that. Think about all the symptoms of this, right? Somebody goes into the hospital for respiratory issues because they have high blood pressure, they have a bad heart, whatever it might be. Maybe they just ran a 5K marathon and they're having breathing difficulties. And they go in there and they die, and maybe they find out, oh my goodness, you have an enlarged heart. We didn't even know. But on the death certificate, they're putting it down as this. Now, they don't want you to know stuff like this. They don't want me talking about stuff like this. YouTube doesn't. Nobody does. They don't want you to be suspicious of anything. This is dangerous to question this kind of stuff. If the CDC is the one telling the doctors to do this, and let's be real, most of these physicians in high places, okay, are members of secret societies. Get with it, because they are. I'm not saying, a family doctor, a local family care guy is, but I'm saying high-level surgeons and all that stuff, people who are coming on TV to speak about this, they're all part of it, right? I mean, how do you think they get on CNN? Is your family care doctor going to get on CNN to talk? Like, oh, we have a doctor here to tell us about the dangers. Well, who is this guy? Where did he sign up? They send around paperwork and say, hey, anyone that wants to be on CNN to talk about it, here it is. And they show up, they have their coat on, they're a doctor at some high hospital. I mean, give me a break. Give me a break. Just like when we see all this stuff with global warming and they bring all these scientists, it's the same story. Nobody questions and looks deeper into anything at all. Even something as ridiculous as that, to say, how is this doctor getting on the news to say it's worse than we think, it's bad. They all say the same thing, right? No doctor comes on and goes, oh, there's nothing going on. They're making it up. And if they do, like this guy did, who, he went on there and said, they're telling us to do this, and I think we're misleading the public, he gets slammed. Right? He gets, oh, but this guy's out of his mind. He's being irresponsible. Let's make sure we deflect off of him. Or this guy's saying the CDC guidelines make no sense. He said a patient who died after being hit by a bus and tested positive for the virus would be listed as having presumed to have died from the virus, not being hit by the bus, regardless of whatever damage was caused by the bus. That's what this Dr. Jensen said in another interview about the CDC guidelines. Listen to that. Patient who died after being hit by a bus but tested positive for the virus would be listed as having presumed to have died from the virus, regardless of whatever damage was caused by the bus. That's not misleading at all. Boy. Jansen also reacted to Dr. Fauci's response to a question, and we've made this guy, just because this guy's everywhere and in our face, how many of these celebrities, you must listen to Dr. Fauci. Can I get a second opinion? You know? If I go to the doctor and he tells me I got something serious, I go and get a second opinion. I mean, that's what you do, right? If you go to a doctor and he's like, you need to amputate your leg, you're just going to go, crap. All right, take my leg, cut it off. You go get a second opinion. But we're listening to this guy like he's the do-all, end-all. This guy looks like he's fresh from Bagelville. So Jansen reacted to Fauci's response to a question about the potential for the number of deaths being padded, in which the director described the prevalence of conspiracy theories during challenging times in public health. And then Jensen said, I would remind him that anytime healthcare intersects with dollars, it gets awkward. So right now, Medicare has determined that if you have the virus, admission to the hospital, you'll get paid $13,000, whatever that means. And if that patient goes on a ventilator, the hospital or whatever, you get $39,000, 3 times as much. Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things have impact on what we do. So he's going the money angle too with it, which I think means nothing in this case, because I think that people are just going to the hospital with their basic problems, right? Their basic illnesses. And it's business as normal at these hospitals, except for when it comes to the certificate, the death certificate. And then family members are like, oh yeah, so-and-so, my brother got hit by a bus. And then they get the death certificate weeks later, and it says that he passed away from this. You think that story's going to end up on CNN? Not a chance. They just want it documented that way so people who are suspicious can look it up. Like, oh yeah, we found this guy's death certificate. It says that. It doesn't say anything about getting hit by a bus. It's a joke. It's an utter joke. And then they do what? They go, oh, well, this is their response. Oh, conspiracy theorists. Oh, boy. We don't have time for that. Everything's so serious that's going on now. It's just a basic deflection. They don't answer anything that you ask. They're the ones who sent the paperwork out. God forbid we be suspicious of anything that's going on in the world that seems suspicious, like this, where they're teaching kids distancing and social distancing practices, which is right out of 1984, the handbook, but we're crazy. And there's still channels on YouTube, which we should just all go to, and we should just go after these people who are, oh, we need to take some of these conspiracy channels down. They're extremely dangerous. They're saying it's 5G. They're saying it doesn't exist. That's dangerous. Why is it dangerous? Oh, are people jumping, off bridges because we're questioning the narrative? Is it dangerous because you guys look like complete idiots who buy into everything that the mainstream media says, and then you tag yourself as engineers or atheist experts, and you know so much about life? You're the dumbest people to ever live. You should just put a zipper over your mouth because your input is worthless. You don't critically think. You just regurgitate what the mainstream media tells you or what you read in a book made by some Mason with an agenda. Oh, let me tell you about what happened when, the Big Bang Theory. Nah, I'm good. Oh, yeah? That's what happened? Dinosaurs took a dump and humans came out of a monkey's rear end and rocks formed and then just the nonsense that these people believe. And then they're like, you believe in a fictional god, a fairy tale. Anyway, I'm going off track here, but those are the same types of channels that are, oh, these conspiracy people. I believe in free speech, but not with what they're doing. Oh, F you. Screw off. They are trying to silence us any way they can, and these idiots going along with it because I don't like how they have subscribers and people listen to them. They're so dumb because they think they're well educated because they memorized the textbook and A plus some tests. Guess what? I A plus some tests and didn't read the textbook and went to college. Total waste of my time and life. Tell you that much. Anyway, so this is what they're doing with the certificates. It's absolutely ridiculous, but this is what we've been saying from the get-go for people that don't understand, how could they be in? How can these statistics be reported? That means this person's in on it, they're in on it. There's so many symptoms of this that they just slap it on the death certificate. Breathing problems, you must have it. Fatigue, everybody's fatigued. Every day. I guess we all have it. Boy, it's a joke. I want to remind everyone, please check out my website at callfornuprising.com, $2.99 a month. Well worth it. Please consider subscribing. Who knows what's going to happen here on YouTube in the future. They could just suddenly zap all these channels that are talking about this because people are getting suspicious. So check it out, callfornuprising.com. I want to thank the Patreons. Because of you, this channel continues to go on. And remind you that there is a Teespring store if anyone wants to help the channel out that way. You get a shirt or a mug or something like that. And also help spread awareness about this channel if you think this channel is worth people knowing about and helping them. So thank you guys all again. Keep your eyes on the BS that's being pushed because it's getting thicker by the day. I thank you all again. God bless you and your families.